topic is dental plaque. So dental plaque is a primary etiological factor for all gingival and periodontal diseases. And during performance scaling, we are basically removing plaque and calculus from a tooth surface area. The different authors give different definitions according to Ringel. Bacterial aggregation of teeth and other soluble structure, that is known as dental plaque. And most acceptable definition that is given by WHO in 1961. According to them, it is specific but highly variable structure in dentate, result from sequential colonization of microorganisms on tooth surface, respiration, and other part of the oral cavity, and they are composed of primarily slimy component using desquamated epithelial cells, debris, microorganisms, and all they are embedded in the extracellular gelatinous matrix. Dental plaque get calcified, that is known as dental calculus, and when we are performing scaling, we are removing calculus along the plaque, and we are making the tooth free from all surface of stains along the scaling. Other soft deposits, they come in the form of material alba and food debris. The plaque is classified into two forms: supragingival plaque, subgingival plaque. And supragingival plaque is further divided into corneal, marginal, and facial, and subgingival tooth-associated, unattached, and tissue-associated. So, as the term indicates, supragingival plaque is that is found at or above the gingival margin. So, that is why it comes in direct contact with gingival margin. So, that is known as marginal plaque. And when the plaque is present below the gingival margin, then it is known as subgingival plaque. And primary pathogen that causing periodontitis, that is mostly present in the subgingival plaque. Then composition of dental plaque. Dental plaque is main consists of microorganisms. Primarily in the initially there is gram positive, and later on they are replaced with the gram negative bacteria. These organisms exist within the extracellular matrix, and these microorganisms they assist in the initial colonization of bacteria on the surface area. Intercellular matrix is divided into two components: organic matrix and inorganic components. From the organic component, mainly consists of proteins, polysaccharides, and other component. The plaque is derived from glycoprotein from saliva and some from a GCF, that is gingival clavicular fluid. And this component is that is liquid 15%, that is consists from the bacteria, host cell, and the food bacteria. Other is the inorganic material, and inorganic is mostly predominant by calcium, sodium, phosphorus, potassium, and chloride. And in supragingival plaque, the source is saliva. In subgingival, that is the source is GCF, that is gingival clavicular fluid. Other form of that is other than bacteria, the other organisms that is present in the plaque may be yeast, mycoplasm, protozoa, and viruses. They are also present in very less amount in the dental plaque. Then stages of plaque formation. The dental plaque may be readily visualized in the teeth after 1 to 2 days of no hygiene. So first is formation of dental particle, then there is initial adhesion and attachment, and the third stage is colonization and the plaque maturation. And within 2 weeks, plaque get mature into the calculus, that is calcified form of dental plaque. So first stage is formation of dental pellicle, that is homogeneous membranous acellular film that covers the tooth surface area and frequently form the interface between dental plaque and calculus, and is mostly derived from saliva and GCF, and some of the component of bacteria and the host cell they are also present in the acquired pellicle. Second is initial adhesion and attachment of bacteria. So that is a step-by-step procedure. So first is transport to the surface, then initial adhesion, then attachment, then colonization onto the surface area, and last is biofilm formation, that is mature dental plaque formation in the oral cavity. So initial stage is transport to the surface. The first stage involves the initial transport of bacteria to the surface is by the different forces, that is random contact may occur by Brownian movement, sedimentation of microorganisms, liquid flow, or due to active bacterial movement. But bacteria at that stage are mostly gram-positive bacteria. Then adhesion, that is initial adhesion, that is reversible in nature. It starts from on the bacteria and the tooth surface area, and there is a different type of forces, long range and short range forces are there. And the energy, total energy is known as total Gibbs energy, that causes adhesion of bacteria on the tooth surface area. Then next is attachment. Then bacteria start attaching on the tooth surface area by different forces, covalent, ionic and hydrogen bonding, and mostly these bacteria interact and they lead to multiplication on the tooth surface area. And more for attachment of bacteria is fibrils, all they helps in the attachment of bacteria on a tooth surface on the oral cavity. Then lead to colonization and the plaque maturation. So bacteria is divided into two types of colonizer: initial colonizer, that is early colonizer, and secondary colonizer. So initial colonizer, they are mostly streptococcus and they are present in case of gingivitis. And later on, when gingivitis start into periodontitis, these bacteria they are replaced with the gram-negative bacteria that are known as secondary colonizer. So these first formation stage is the acquired pellicle. In most of that is the gram-positive bacteria are there. And when we are performing scaling, the number of these bacteria reduces. But when this bacteria remain in the oral cavity for a longer time, this number of bacteria increases and convert into that is secondary colonizer and lead to periodontitis in patient. And secondary colonizer, these are mostly bacteria that causing chronic periodontitis or aggressive periodontitis in a patient. Then in that stage, co-aggregation occurs. So in the co-aggregation, gram-positive and gram-negative bacteria, they get interact with each other. And the later stage, the co-aggregation, most of them are gram-negative bacteria. And they can also lead to formation of corn-cob formation in a colonization stage. Microbial complexes that is given by Sukranski, they divide into early colonizer and then that is secondary colonizer. So primary colonizer are also known as that is initial colonizer and that is streptococcus is present in that. And in the secondary colonizer that is present when the patient is suffering from periodontitis. Red color indicate when there is bleeding or probing is there, and these bacteria they have capacity to invade into the connective tissue. So that is why when we are performing scaling in severe to moderate form of periodontitis, we give antibiotic to prevent invasion of these bacteria into the oral cavity. So there are some bacteria that can invade into the oral cavity, that is connective tissue, and these bacteria they have different virulence factor, that is factors causing disease in the patient. So these bacteria by number of virulence factors they causing effect on connective tissue and convert in gingivitis to the periodontitis. These are most common bacteria, P. gingivalis and AAC, that is causing periodontitis in the patient. Next is a number of factors that can lead to increased plaque formation at the surface area. So surface irregularity, that is caries to that is patient is not maintaining oral hygiene, RPD, FPD. All these increase the factors that will increase the incidence of dental plaque inside the oral cavity. So variation in dentition is that is there is more calcular formation in the molar area as compared to anterior, and plaque formation is more in the lower jaw as compared to upper jaw, and on the maxilla buccal surface is most commonly involved with that of a dental plaque and calculus. Last is a plaque hypothesis. So first the plaque hypothesis that comes is a non-specific plaque hypothesis that is given in 1976. So first they thought that the amount of plaque is more important than that of a type of bacteria. So as the amount of plaque is more in the patient, it will lead to more severe form of periodontitis and gingivitis in the patient. That is a non-specific plaque hypothesis, that amount of plaque is more important than that of a type of organisms. Later on, that plaque hypothesis is replaced with the specific plaque hypothesis, that is specific bacteria is causing specific disease in the patient, especially in case of aggressive periodontitis. Then third type of plaque hypothesis is ecologic plaque hypothesis, that is when the ecology shift in ecology occur, it will lead to change in the microflora and gingivitis can easily convert into periodontitis. So in conclusion, dental plaque is a all primary etiological factor for all and gingival and periodontal diseases. And when we do scaling, we are basically removing plaque and calculus from a tooth surface area, and we helps in maintaining the health of a palation. So in healthy patient, when the palation is healthy, the scaling should be done after minimum interval of 6 months to 1 year. But when the patient is suffering from periodontitis, that interval is reduced depending on the sign and symptom.